Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of February 14th, 2022. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. And right now we are on the cusp of the lifting of mask mandates for most of the Bay Area, with the exception of Santa Clara County. And I will go through today some of where I think we are and what we may want to be thinking about as this policy change takes effect. Currently, our total cases, and this is the previous 14-day case count, and we are coming down nicely, but I wanted to point out here that we are still quite far above where we were even in our worst previous surges. So our peak of all time was 12,470 cases with last winter's peak. And we're now well above that with over 16,000 cases. So although it's coming down, we're still higher than we've been with any prior surge. With respect to hospitalizations, also coming down, which is good news. We are at 256 people in the hospital with COVID-19. In the height of our summer surge last August or so, late August, the highest it got was 236, so we're still again well above that. In terms of deaths, there have been 1,687 individuals in Alameda County who've lost their lives to COVID-19, and that is up 44 individuals from when I reported last week. And although we don't have this breakdown for the county of Alameda, we do have it for the state of California. Continues to be very compelling in that those who are unvaccinated are more than 21 times more likely to die from COVID-19 than those who have been fully vaccinated with their booster dose. And so really those who are having the most severe outcome, losing their lives to SARS-CoV-2, are really the remaining unvaccinated. Now, back in October of 2021, our Bay Area counties got together and put forward this criteria for lifting indoor mask mandates. I presented this in the first briefing of November. And those criteria were regarding community transmission, regarding hospitalization, and vaccination. And so where we are currently is that community transmission is not moderate, it's actually high, as defined by the CDC. Hospital numbers are not low, and they're not stable. And we're just barely at that 80%. We're at about 82% of the total population that is fully vaccinated. Although you could argue about what fully means. We're just over half of the population being boosted. And certainly this criteria was developed in October, so before Omicron. And we know that with Omicron, the vaccines are less effective now. So you could certainly argue that this percentage should actually be higher than 80%. But nonetheless, and here in Oakland, we haven't even quite hit that 80%. We're just below at 79%. And so we've just barely met the number 3 metric, not number 1, not number 2, but nonetheless, all of the counties with the exception of Santa Clara County are going to go ahead and lift those mandates. And so some of the updates that I want to go through, I think are pertinent to understanding where we are, and particularly in light of this policy change. And so one thing that is happening right now is that we have a new subvariant of Omicron called BA.2. It's just kind of coming on the scene here. We've seen it sort of take over in other parts of the world already. We're not really sure if that's what's going to happen here or not, but I point it out because what we have found, or what has been discovered, is that the monoclonal antibody sotrovimab that was working against Omicron does not seem to be too effective against this BA.2 sublineage. And this is a more contagious, believe it or not, more contagious than Omicron, and it is evading our monoclonal antibody. The good news is that on Friday, the FDA did authorize emergency use for a new monoclonal antibody, bebtelovimab. I probably didn't get that right. I barely just got sotrovimab, and now I got to learn a new one. But it has been approved, and the Department of Health and Human Services announced their plans to continue to distribute monoclonals. Are going to distribute at least 600,000 treatment courses. This is a free medication. And this will go out to the states, not sure when, but this is reassuring because this is happening quickly when BA.2 has not yet taken over, and we seem to hopefully be acting in time. So I hope that this is certainly a sign of things to come in terms of our ability to quickly respond when we are seeing early signs of new variants. So this is reassuring because we are being told about this variant soon. We're sequencing enough to know about it early on, and we're even getting the treatments kind of approved and distributed, hopefully in time. So that is good news. I will, give the caveat though that treatment is not for everyone. It is not available even with the oral treatments that we have and the monoclonals that we have. There are nuances to each one of them. Not everyone is eligible. I've gone through that in some detail previously. But also I have to say that none of these are approved for children. And so all of the treatments that we have so far are for those 12 and up. And so that leaves out a significant portion of our population, and a portion of our population that is being more and more impacted, proportionately speaking, than ever. So we started as sort of this pandemic of the elderly, in a sense. That's who we were losing. That's who was getting very sick. And the impacted population is continuing to sort of march towards a younger and younger age group. And so I wanted just to make sure that we're all aware that these treatments, because we talk about the treatments a lot now and how great it is that we've got antivirals, we've got more targeted treatments. But I think it's important that we all understand that this is only for those 12 and up, despite the fact that we may have little ones who are at risk of poor outcomes. And it is much more difficult to provide any type of outpatient treatment. And sort of speaking of children, we had a little announcement, a big announcement on Friday that from Pfizer that it wasn't going to basically submit the data that we were awaiting, but that they were going to wait for the data on their 3-dose regimen. So remember that we got the information that the 2 doses really wasn't enough, especially for the 2 to 5-year-olds. The 6-month-old to 24-month-old actually seemed to do well, and so there were certainly questions about, well, why didn't they just submit for that age group? And I really don't know the details of why this decision was made. I'm hopeful that it's because they're confident that the 3-dose is going to be what's going to be recommended, and that they'll be able to get that data in and just have the FDA review it all together. So hopeful about that. They anticipate having the 3-dose protection data available in early April. And remember that we've already seen that the vaccine has demonstrated safety in this younger age group, and now we are waiting for them to show us the effectiveness, and the 2-dose just didn't quite make the cut. So I think this should also be reassuring to us that we know that they're not just waving things through. This should be reassuring to anyone who kind of has concerns about process, that they didn't just go ahead and barrel ahead even though it wasn't quite as effective as they wanted it to be. We are on hold essentially until Pfizer submits the 3-dose data, hopefully in a couple of months here. So kind of to recap, cases are high. They're coming down, but they're still high. We have a new sublineage that's kind of percolating out there, the BA.2 variant that is evading one of our treatments. We've got some treatments, but they're not yet plentiful, and they're not for everyone. They're not for children. And our vaccines for the 0 to 5-year-old age group is pushed back. So why are we dropping the mask mandates now? And so here is a press release from our public health officer, and notice that we're in good company. There's a number of other health jurisdictions that are going the same route. I believe 12 the last time I looked. And this press release explains that masks are still strongly recommended, and that vaccines and boosters are urged, and that unvaccinated individuals over 2 will continue to be required to wear masks in all indoor public settings. So, of course, not all venues are asking for vaccination requirements. It's not clear whether this means vaccinated and boosted exactly, but I think for purposes of this, we're apparently on the honor system, I guess. So if you're not vaccinated, you're supposed to wear your mask. If you are, you don't have to. There are exceptions to this: public transportation, healthcare settings, congregate settings, so the jail, homeless shelters, long-term care facilities, our schools, and also childcare settings. And then there's sort of, a note at the end that says that community members who are vaccinated and choose not to mask should respect the choices of those who continue to mask. Can't legislate that, obviously, but officials are asking residents and visitors to be kind and respectful as people evaluate their risks and make choices to protect themselves and those around them. So it's sort of like, a little bit of a everyone for themselves message. Again, where we have cases are still high, so there's still a lot of SARS-CoV-2 circulating around in our environment, quite a lot. And all of the other factors to consider that I mentioned before. And so what will this mean? And I think how big of an impact this will actually have is pretty difficult to predict. And I suspect that will be very, very different depending on where you are. Depending on what city you're in, even what neighborhood you're in, and what part of the country you're in, because we know that many other places are also dropping their mask mandates, or already have done so a while ago. And we see that cases, are different in different parts of the country. And I think that this will continue to be the case. And here in the Bay Area, I'm sure that we'll still have a lot of people who continue to wear a mask, and that this will just vary depending on what type of venue and so on. But I think what concerns me the most is probably the message that it sends, especially at this time with all that I've kind of already outlined. Because if you impose restrictions when things are bad, then it stands to reason that if you lift them, people will think things must be good. And as I've outlined here, things are quite far from being good. In fact, the last time that mask mandates were prematurely dropped by the CDC was in May, right before the terrible sort of summer surge. We were around 500 to 600 deaths per day in the United States. We are now around 25 to 2,600 deaths per day. So we are a good, 5 times where we were then. And it did seem to play a role in the surge. Remember, that dropping of the mask mandate happened after we knew about Delta. And so again, it feels a little bit concerning. The other part of the message that feels concerning is sort of an everyone for themselves message, right? Sort of you can keep fighting, you can give up, but the government is going to back away a little bit here. And when restrictions are lifted, then the concern follows: will support be lifted? Will our data gathering be lifted? Will we stop receiving resources? Will that be what's next? So those, I think, are all valid questions and concerns that we should be asking. So it's not sort of clear to me why now. I think we all understand that we are going to go through ebbs and flows. And I think the hope is that this can be reversed if it needs to be. But the why now piece is a little hard for me to wrap my head around, and I know for a lot of us it's a little challenging to try to understand why now. Is it fatigue? Is it surrender? Or is it really just now sending the message that this is a new time in the pandemic where we are going to make this an individual responsibility? And so, but any of those, any of those explanations, fatigue, surrender, or just individual responsibility, none of these are very comforting at all. And so just because we're tired, doesn't mean it's over. And just saying that it's an individual thing doesn't make it an individual thing. Because just because we're going to get away from collective efforts, it doesn't mean that it's not still a collective problem. It's a pandemic virus. It's a virus that spreads from person to person. We live in this world together. So given all of that, what can we do? So I think, for those of us still in the fight, then I think it's first important to say that it's important that we continue to stay informed and understand that these policy decisions in and of themselves don't mean things are good or things are better, and that really that they may not, must not sometimes be designed to actually improve our pandemic performance. They may be other considerations, but it's not to improve where we are in the pandemic per se. So for those of us who are still hanging in here, not surrendering, I think our calculations need to change. It's time for us to do some new math. And I know we just finished having to do new math with Omicron and how contagious it is. But I think we may need to recalibrate based on this one-way masking. And so one-way masking meaning if you're the only one masked in an indoor environment and everyone else is not masked, that's a very different situation than when everyone was masked. So what does that mean? You may need a better mask. You may need a better fitting mask. And I just recommend trying different ones to see which one really gives you that seal. I've gone over this in prior briefings. I like projectn95.org. They vet all of the masks and they have a really good variety of different sizes and shapes, and it's a reliable source. It may mean you stay shorter time because maybe, because it's only a matter of time before sort of the air fills up in the space. And so it may be a matter of a calculation that you spend less time in the space. I'll just put this up again. This is from the California Department of Public Health. I really like this infographic. It's sort of the good, better, best of the masks. And, we may need to go to best at this point. If you're the only one wearing it, you may need to go to best, depending on the situation that you're in. I think the other thing we can do is that if you're responsible for a business or a gathering, or you're going to be hosting a gathering, you're in charge of an organization, we need to take responsibility for the safety of those who come in. And I don't know that we always sort of think this way completely, but it's something that I think makes sense to do. And so there's no law that says you cannot continue to require masks in your place of business, in your organization, in whatever venue or gathering that you're hosting. Although I have to say it's a lot harder now. It will be a lot harder now without that backing of policy behind you. But nonetheless, that's still your prerogative. You can implement testing, you can implement improved ventilation, you can implement, proof of vaccine, you can implement a bunch of other mitigation strategies that I've gone over, around your indoor air quality. And of course, to prevent the most severe and tragic outcomes from SARS-CoV-2, vaccination and booster are still really remarkably holding up and very effective at allowing you to survive even in the event that you do catch SARS-CoV-2. And so as you are doing all of the things that are possible in order to protect yourself, one of the most critical ones is if you do not have a primary care provider, please get one. Make sure you know how to reach them before you need treatment for this or anything for that matter. But certainly in this context, not everyone is getting treatment. Not everyone is getting access to treatment. And more, if we are going to make this an individual problem, an individual issue, more and more, it is going to mean that in order to have access to these resources, you are going to need a primary care provider. So please get one. If you're not clicking with the one you have, just find another one. And of course, take good care of yourself, eat a balanced diet, get some exercise, some fresh air, manage your stress, take a multivitamin supplement, consider additional vitamin D supplementation, and get a good night's sleep. Thank you so much for joining us, and we will see you next Tuesday at 10 a.m.